This is Maya. She's a 12-year-old chow with glaucoma. She loves people and loves to look out the window. Maya also likes to mooch cheese. Maya was fine until she was about 9. Then one day we noticed that she was bumping into things. She'd lost her right eye to glaucoma. In dogs, it happens just like that in a couple of days. Her eye specialty vet explains.
Glaucoma is a common disease in dogs that causes vision loss and pain from high pressure within the eye. There are many different ways that glaucoma can occur in dogs, but in all cases, the normal drainage in the eye ceases to function appropriately and fluid builds up, causing pressure. In Maya's case, she was born with a genetic ticking time bomb in both eyes. Called primary glaucoma, it can affect any breed of dog, though it's more common in some breeds. Unfortunately, there's no way to prevent primary glaucoma. In the right eye, vision was lost, and so an end-stage procedure was performed to afford her permanent comfort. The doctor took out the inside of the eye and put in a prosthesis, but it moves like the other eye.
In this picture, you can see light in the real eye and none in the fake eye, but most people can't tell the difference. She needs drops in her eyes several times a day. She hates getting drops. She did just fine on the drops for over 3 years. In early March 2018, she suddenly started bumping into things late one evening. Her eye pressure was way above normal and she was blind. From her eye vet, I knew there was a drug that could bring back her sight. We were at the vet all night, but she got her sight back, and that cost $500. That lasted 2 weeks, and then she went blind again. On March 18th, the eye vet and I decided the only option was to do surgery. Her eye vet explains.
When it was clear we were losing the battle to glaucoma, we were able to perform surgery within her eye as a last attempt to preserve her vision. We entered her eye using a surgical microscope and removed her lens. Then the endolaser probe, which has a camera and laser attached, provided laser therapy to reduce fluid production within the eye. Maya's pressures returned to normal levels and her vision was restored.
These operations are very expensive. The operation and aftercare cost over $7,000. Fortunately, Care Credit offers a 6 months or a year free interest, and then if you haven't paid it off, you end up paying the accrued interest of 26%. Maya got her sight back. Here she is at 3 weeks after the operation.
Our goal with this procedure is to gain more time with vision. Unfortunately, there's no cure for glaucoma at this time, and so Maya's battle was not over.
What we didn't know is that Maya had an underlying infection in her liver that probably caused the eye pressure spikes. Due to the surgery drugs, testing and getting results took a month. Just as the drugs for the liver infection were ordered, her eye pressures began to go up again. UPS lost a package, so the drugs I'd gotten from her vet ran out, and we had to start all over. While waiting for the drugs to show up, she went blind again. Maya has recovered from the infection, but she has not really recovered her sight. The tests say she's blind, but she goes around obstacles outside, even in new places. We think she has some residual vision. She's learned to get around pretty well. You can look for redness in the eye or signs that the dog is suddenly not seeing. Take the dog to the vet as soon as you see a problem. Friends have been generous in helping to pay for Maya's bills, but there is still nearly $10,000 to cover. Please help through a donation to save Maya's sight.